Vessels, nerves and superior extensor retinaculum in the anterior compartment of the leg. Let us discuss each structure in detail. Vessel which we have in this compartment is anterior tibial artery. This anterior tibial artery is a branch from popliteal artery. After its origin, it goes between the two heads of tibialis posterior. It goes to an oval opening in the interosseous membrane and enters the anterior compartment, passes over the interosseous membrane, goes downwards and it goes in between the two malleoli, and where it divides into branches, it is going to give dorsalis pedis artery. Relations of this artery: it is related posteriorly to the interosseous membrane in the upper part. In the lower part, it is related to the tibia and the ankle joint. Front relation or anterior relation: it is covered by muscles in the upper part. In the lower part, it is covered by the extensor retinaculum. Towards the medial side, we have the tibialis anterior muscle related. Towards the lateral side, we have the extensor digitorum longus, peroneus tertius and the deep peroneal nerve which is related. Deep peroneal nerve is related laterally in the upper part and the lower part. In the middle part, it is related medial to the artery. Branches of anterior tibial artery: it has various recurrent branches. We have the anterior recurrent branch and we have a posterior recurrent branch. Posterior recurrent branch goes towards the knee joint and participates with genicular anastomosis with the genicular branches of popliteal artery. The anterior recurrent branch goes towards the knee joint and participates with the genicular anastomosis with the genicular branches of popliteal artery as well as circumflex arteries. If you take, it has many muscular branches which will supply the muscles which are there in the anterior compartment of the leg. It has malleolar branch, we have anterior medial malleolar branch, we have a anterior lateral malleolar branch. Anterior medial malleolar branch, it goes behind the tibialis anterior and it goes towards the medial malleus, and it will going to form the medial malleolar anastomosis with the branches of posterior tibial artery as well as medial plantar arteries. Anterior lateral malleolar branch goes behind the extensor digitorum longus, peroneus tertius. It goes towards the lateral malleus and participates in the lateral malleolar anastomosis along with the branches of posterior tibial artery and also the tarsal branches. Deep peroneal nerve: it is a nerve of the anterior compartment of the leg. This nerve takes its origin from the common peroneal nerve at the level of neck of the fibula. Course of this nerve: after taking its origin from the neck of the fibula from common peroneal nerve, it goes deep to the peroneus longus, come to the anterior compartment, it runs deep to the extensor digitorum longus, it runs vertically downwards, it will be crossing the vessel twice. So, this nerve is also called as nervae hesitans. In the upper and lower part, it is lateral to the artery, in the middle part it is medial to the artery. Later it goes towards the ankle. At the level of the ankle, it divides into two terminal branches, one medial branch and one lateral branch. It is going to supply the dorsum of the foot. Branches from this nerve are muscular branches and articular branches. The muscular branches will supply the muscles which are present in this compartment like tibialis anterior, extensor digitorum longus, extensor hallucis longus and peroneus tertius. The articular branch will supply the ankle joint. Superior extensor retinaculum of the anterior compartment of the leg. This is a thickening in the deep fascia which is present above the ankle joint. It is almost 1.5 inches in thickness. Coming to its attachment, it has a medial attachment, it has a lateral attachment. Towards the medial side, the retinaculum splits to enclose a tendon of tibialis anterior and gets inserted to the anterior border of the tibia. Towards the lateral side, it gets inserted to the anterior border of the fibula. Coming to its relation, towards the medial side, it encloses the tibialis anterior tendon. Next, there are deeper structures from medial to lateral side. We have the extensor hallucis longus tendon, extensor digitorum longus tendon and we have the peroneus tertius tendon. Apart from these tendons, we have the anterior tibial vessel, deep peroneal nerve which is situated behind the extensor hallucis longus. And function of this retinaculum is to maintain the position of the tendons in its place during the dorsiflexion of the foot.